So moving to the next syndrome we should be discussing this evening, we'll talk about the Lesch-Nyhan syndrome. Lesch-Nyhan syndrome. Alright. Now, even if you don't understand anything in this lecture, I just wanted to understand something. In Lesch-Nyhan syndrome, the patient has the tendency of injuring themselves. Now, if you look at this boy, they tied his hand, because if they let his hand to himself, they tied his legs, they tied his other leg, they tied the other hand. He's looking friendly, right? But if they allow him to himself, he can injure his mouth, injure his tongue, bite his hands out. Bro, it's a really crazy thing. So what's the Lesch-Nyhan syndrome? It's just it's a deeply complex genetic disorder. So before you can have this, your immune system, you must have inherited it from your parents. Okay, so it affects how the body processes purines, okay, essential building blocks of DNA and RNA. Do you understand? So basically, this is the root of the issue. All right. So what causes is genetic mutation. So it's usually caused by mutations in the what? Hypoxanthine-guanine phosphoribosyltransferase enzyme. Now the enzyme should have, if it is there initially, it should serve to kind of like recycle purines. Do you understand? But because the enzyme is not there, you are having a too much, accumulation of these purines. Okay, so it is inherited in an X-linked recessive manner, meaning its primary affects males. So female is only a carrier of this, So what we have here is this. Can you see the features? So key symptoms. There's neurological issues like poor muscle control, involuntary movement, developmental delays. There's also behavioral issues like self-mutilation. You have a tendency of injuring yourself. Okay, so patient may bite their lips, their fingers, engage in head banging, So overproduction of what? Uric acid. Okay, so there's no recycling again of purines. That's a primary issue. So why the neurological issues? So the mechanism is unclear, but the deficiency leads to what? A low level of dopamine. Okay, now dopamine should actually regulate your movement and behavior. All right, now this could actually even take you to like the treatment. So you can now be thinking that if I replace dopamine in a patient that have these issues, it should kind of like serve to kind of like reduce, So diagnosis is genetic testing, enzyme assays. Of course, you are also looking out for clinical symptoms where you are seeing a patient that is injuring themselves like this. Okay, so treatment allopurinol because I want to manage uric acid levels. All right, then behavioral and neurological symptoms are harder to treat, so they often require supportive care. So no cure exists as at the time of me recording this video. Okay, so that's it for Lesch-Nyhan syndrome.